What exactly is NeuroQ? How does it work?
So NeuroQ is actually a software program that we use to help us look at the brain PET scans. Brain PET scans can be challenging to read, especially since a lot of parts of the country the brain PET is being underutilized, and so the radiologists there, the nuclear medicine doctors there don't see a lot of brain PETs. They tend to see a lot of whole body PET scans for cancer. We're like a central site, and people all over the country can send their scans to us, and we can give an expert reading of those scans. But eventually people will want to develop their own facility for giving expert interpretations, and one of the things that helps to do that is to have not just your visual interpretation of what you see, but to be able to measure how much things are changing region by region through the brain. NeuroQ is a way to automatically make those measurements in hundreds of brain regions in a matter of a few seconds that would take so much time that would be impractical to do in a clinical setting otherwise.
So the NeuroQ software actually goes in and can detect certain parts of the brain collectively just within a few seconds to see where the trouble spots are, right?
That's right. So a brain PET scan is entered into NeuroQ. The NeuroQ applies these regions of interest over the brain tissue. So it basically measures across 200 to 300 different brain regions all at once how much activity is in each of those regions, and then compares that amount of activity to what would be in a normal database, what would be the right amount of activity to have in each of those regions, and then tells you, virtually instantly not only how much activity is there, but how abnormal that is for that region, or whether it's within the normal range for that region.
You can actually determine dementia versus Alzheimer's, or different types of dementia, can you not, with this?
With the information in the PET scan, you can determine among the different possible causes of dementia. We call it the differential diagnosis of dementia, in a way that's much more accurate than trying to make that distinction with just everything else but that. So the history and the physical and the blood labs and the MRI and the neuropsychological testing all together have a substantial improvement of accuracy when you add the PET scan to that.
How much radiation exposure is there, if any?
PET scan that's done for the main information we're looking for, and since most PET scanners around the world today are PET CT scanners, there's a small amount of radiation that comes from the CT scan as well. But to put it in perspective, the amount of radiation that someone would get from getting a brain PET scan is about 1/5 of what I'm allowed to get every year just by working here.
Let's say you have someone who's very concerned because they have relatives who've gone through Alzheimer's, have had the disease. How soon can someone actually have one of these PET scans and have it go through this NeuroQ software in order to determine whether or not they are susceptible or will get this disease?
It can detect it much earlier than anybody would want it to because even before you have your first symptom, you can see changes in the brain PET scan that you can measure with something like NeuroQ, and you can visually see them at the time that patients would still be considered to be normal by psychologists. But the patient might feel, I'm not quite up to the par I used to be, and then that's a real problem for what does the neurologist do, or the psychiatrist, or the geriatrician is, well, they'll make sure there's nothing physically wrong with them, and they'll try to make sure they're not depressed, and if they are, treat them for that. But beyond that, they can send them to a neuropsychologist, and the neuropsychologist can do a whole battery of tests, but they may all come back normal because the range of normal is pretty wide for all these tests. But for someone who's very high functioning to begin with, they can lose quite a bit of their brain activity before they would fall outside the normal range.
So someone like in their 30s, 40s could have this test?
You could. You could see in someone in their 20s who have the gene for Alzheimer's disease but won't develop it for another 40 or 50 years, already changes in the parts of the brain that decrease the most significantly in the early stages of Alzheimer's disease. So it's way more sensitive, like I say, than you'd want it to be even at this point, because we don't have preventive therapies to give to people who have no symptoms. That might change, that people are working on vaccine therapies, for example, and then if those became available, then it would make sense to get a PET scan in your 20s and see if you should get the vaccine, perhaps. But right now, the time to get it would be at the time that you start to have symptoms that may be something more than just normal aging. And at that time, there's no accurate way to know what's going on unless you look at what's happening inside the brain, and that's what PET does for you.
So what happens if you have a positive result from a PET scan with NeuroQ software? What happens when someone gets a positive reading?
If you have a positive reading in the sense that it shows that you do have an early dementia process like Alzheimer's disease happening, then what will happen to you in practice actually depends a lot on who your doctor is. And how their style of practicing has evolved, because, as I say, until the mid-90s there were no drugs to treat patients with Alzheimer's specific for Alzheimer's, and now there are, but if you look at the formal FDA indication, you're supposed to wait until you're demented to take them. It could be early dementia, but you're supposed to have those criteria of having multiple cognitive domains and progressing to a level of severity that affects your ability to function. But there's a lot of neurologists who are kind of more forward-thinking than that and happy to prescribe them off-label if they're convinced that these early changes that people are having before they're demented are the early stages of Alzheimer's disease.
Obviously, you talked about the statistics, the percentage of success rate when you're talking about using the PET scan and the NeuroQ software, that you're getting about a 90 to 99% accuracy as far as determining whether someone has Alzheimer's.
Sensitivity is about 95%, even for the earliest stages. So one of the things we did in our original research was take just the people who only had mild dementia, or even what they call questionable dementia. So the earliest group of patients who were being worked up for dementia. And even in that group, the PET already had a 95% sensitivity, and proven by following those patients all the way to the point of death and autopsy.
Is this software being used widespread, or if it's not, why not?
PET scanning itself is very underutilized. But if people do get a PET scan and they're at a center that does a fair number of those, then the centers often use quantification tools, and NeuroQ is the leading quantification tool for brain PET in the United States.
Ask your doctor about a PET scan with NeuroQ, or visit us on the web for more information about costs and scheduling.